Hey ho, let's go. My name is Dr. MarkAlain Dery. I'm Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. I live right here in New Orleans, Louisiana, and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. And as providers, we have drastically seen how the realm of public health has influenced our professional lives, whether we serve in academia, administration, and research, in private practice, or within the hospital setting. COVID has become synonymous with the term public health. Recently, it's dominated our dialogue over the last year and a half, and rightly so. But we all know that there are other issues that deserve attention too, so we will address some of those today. But you best know the ACOI for providing a variety of quality CME for physicians, both online and in person. And more than providing internal medicine CME, the ACOI has been working diligently to keep you up to date by sharing updates on the ongoing COVID-19 saga, as well as expanding our coverage to include other public health concerns as well. But coming up next month, coming up this month, so let's do that again. But coming up this month is the ACOI Annual Convention and Scientific Session, so make sure to join us in person, wow, in Orlando, October 27th to the 30th. And if you can't make it in person, you can go virtually, so hopefully we'll see you there. I'll be there. I'll give some lectures. So let's go ahead and get started. Let's talk about long COVID. You've undoubtedly heard the term long COVID. This is a nickname of sorts for the condition that many people are discovering are the long-term effects having been infected with the SARS-CoV-2 virus. Now we're starting to see some evidence that COVID may actually have long-term cardiological implications as well, and this is something that I have been fearing for some time. So this was a study led by a clinical epidemiologist in St. Louis, and they found that heart damage from COVID-19 extends well beyond the disease's initial stages. It also found that people who were never really all that sick and didn't require hospitalizations risk developing heart failure or deadly blood clots upwards to a year later. Yes. A year later. Now, the study found that the chances of a heart attack or a stroke or another major cardiovascular event in the first 12 months of COVID recovery actually increased with the severity of the initial bout with COVID, which makes sense. But here's where it gets interesting. When you compare the risks of suffering heart complications with individuals who survived COVID to the risk in their peers who didn't get COVID, it was discovered that a non-hospitalized COVID patient who had a 39% increased risk of developing heart failure. That's a 2.2-fold increased risk, and also had a 2.2-fold increased risk of a pulmonary embolism in the following year, compared with those individuals who never got COVID. And even more interesting is the risk for individuals who've been hospitalized with COVID. The risk is actually much higher. Instead of nearly a 40% increase in risk for those who are not hospitalized, there's actually a 5.8-fold increased risk of cardiac arrest, which is a 14-fold greater chance of myocarditis or inflammation of the heart muscle for those who had serious enough COVID symptoms, and they actually end up in the hospital. Now, for those who were in the ICU, when they suffered from COVID, their risk showed almost 1 in 7 suffered a major adverse cardiac event within a year, and that they likely would not have had it had they not had COVID. So the big question is why. We're still, this is still obviously being defined, but it's possible cause of the heart damage could be due to long-lasting damage from direct viral invasion of heart muscle cells, or that the cells that line the blood vessels may have persistent inflammation that would continually linger. Also, the complications of social isolation, dire financial consequences, and the trauma associated from the pandemic is also thought to have influenced some of these cardiovascular risks. Now, another long COVID concern is some new research that is suggesting that COVID-19 could actually trigger diabetes. Now, this is being studied due to some COVID-19 patients having developed symptoms of diabetes after infection, making scientists wonder if COVID-19 could in fact be the culprit. There is much more to be uncovered on this, but there are some early findings that are suggestive that the coronavirus could be prompting the pancreas to self-destruct. Now, it is suspect for sure since the pandemic progressed, but there is a growing number of reports suggesting that people who got COVID-19 were noticing diabetes symptoms for the first time. There is an interesting theory out there that is suggesting that the body could be confusing pancreatic cells for coronavirus and trying to destroy them, and hence disrupting the insulin supply. That's fascinating to think about it, which turns the COVID into another autoimmune disorder. Okay, but there's so much still to learn, and if you're attending ACOI convention and scientific sessions in a few weeks, you will learn more about the varying risks posed by long COVID, because that's in my session. That's right. All right. So let's really quickly go to drug prices and how they are a real public health threat. One of the most frustrating things in public health from my perspective is seeing treatments formulated, and these are miraculous prescription drugs that are approved and made available to help manage and treat dangerous diseases and chronic conditions, yet there is a growing inability for a large portion of Americans to be able to actually afford the prescription drugs that they need. The epidemic of rising drug prices isn't new, and I'm convinced that exorbitant costs charged by Big Pharma has vastly contributed so that many Americans are not being able to get the care that they need. Then, a story came out a few days ago about Merck that just goes ahead and it just proves the point even further. So Merck recently announced the plans to request emergency federal authorization for molnupiravir, and this is a new drug for COVID. It's a polymerase inhibitor, and this is a 5-day course antiviral that actually was shown by press release. We haven't seen the study yet. That the risk of COVID-19 hospitalization can be cut in half with patients who have mild to moderate cases. And of course, this is awesome. We love that. That's the kind of innovation that we need to take down this pandemic. But the same day that Merck unveiled the results of the trial, there was also collective excitement about molnupiravir, which is an effective tool against COVID-19. And it was reported that the federal government was going to be charged a price of $700 per patient to buy that drug. And when I say the federal government is buying the drug, that's our tax dollars. So further translate that to mean that American people are buying the drug at a highly inflated price, especially when you consider the drug costs $17.74 to produce. Now, that's easy to understand how Merck is being accused of price gouging. Super easy to understand. Same is true with other drugs. Just compare the cost of what insulin, for example, costs Canadians, which is $12 a vial. In America, that is average is almost $100. So while we have an epidemic of chronic disease, it is being said that the epidemic of greed in the pharmaceutical industry is actually a much bigger problem. Of course, when it comes to HIV medications, these are drugs that the government buys at top dollars. And fortunately for our patients that are living with HIV, they do have access to these medications. But the government is not able, and Medicare is not able to cut deals or negotiate drug prices as a result of Medicare Part D. And that definitely needs to go. But that's something else. All right. I'm going to end on some good news because this is actually really, really good news. And we're talking about malaria. So there's a recent announcement that there's a development of a malaria vaccine. For those of us who've been to Africa or Asia or wherever there's malaria, and for those of us who got malaria, let me tell you, not fun at all. This is really, truly a miraculous development. The world's first malaria vaccine and the world's first malaria vaccine is also the world's first anti-parasitic, or it's his first parasitic vaccine. It was endorsed last week by the WHO, the World Health Organization, which will have big implications on how countries that are affected by malaria can hope to manage the disease. Now, in Africa, a continent with 1.3 billion people, malaria accounts for nearly 500,000 deaths each year. Thanks to the success of clinical trials carried out in Ghana, Kenya, and Malawi, now there is hope for this horrible disease. Since 2019, more than 800,000 children have received the vaccine as part of their trials. That same year, in 2019, there was an estimated 215 million cases of malaria throughout the world. So, thanks to the promise of this new vaccine, I definitely look forward to the day when that number is 0. And please, we will definitely get there. And again, as somebody who had falciparum malaria, I think I was out in the jungle between Burma, Myanmar now, Burma and Thailand, in the northern region, in the border area, and I got put in the sick hut for 10 days, and there I was, 10 days lost out of my life, and unfortunately, I came through it, but it was a harrowing process, and I was very lucky, very, very, very lucky, given how remote I was, and I was on doxycycline. It was at that time, falciparum was still sensitive to prophylaxis with doxycycline, but anyway, that's the way it works out. So anyway, stay on the lookout for these updates, and to read more from the sources used in this report, go to acoi.org/resources, together with the ACOI. Hello, ACOI. Thank you for letting me do these videos. I will help you have the latest information to help you respond to your patients. As always, feel free to please reach out to me at madery@mac.com. Please stay safe, and as always, thank you, Gina, for another brilliant script.